Ipamorelin in bodybuilding, the clean growth hormone Secretagogue. Introduction. When it comes to peptides in bodybuilding, many athletes are looking for one thing: growth hormone stimulation without nasty side effects. Ipamorelin is often called the cleanest GH secretagogue because it selectively triggers GH release without spiking hunger, cortisol, or prolactin like older peptides. But what exactly makes Ipamorelin so special, and how do bodybuilders use it in real cycles? Let's break it down in full detail. What is Ipamorelin? Class: growth hormone releasing peptide, GHRP. Mechanism of action: binds to ghrelin receptors in the pituitary and hypothalamus. Stimulates the release of endogenous growth hormone, GH. Increases IGF-1 production in the liver, aka anabolic effects. Unique point: compared to GHRP6 or hexarelin, Ipamorelin does not raise cortisol or prolactin significantly. This makes it much more tolerable for long-term use. Half-life: 2 hours. Requires multiple injections daily for steady effect. Why bodybuilders use Ipamorelin? Muscle growth, indirect via IGF-1. Increases protein synthesis. Enhances muscle cell recovery and regeneration. Fat loss. Boosts lipolysis, fat breakdown. Helps maintain muscle during cutting. Recovery and joint health. Stimulates collagen synthesis. Repairs tendons, ligaments, cartilage. Sleep and anti-aging. Improves deep sleep. GH released in pulses during sleep. Slows aging markers, wrinkles, skin quality, and tissue health. Synergy: often combined with CJC 1295 for maximum GH pulsation. Dosage and protocols: standard bodybuilding dose, 200 to 300 micrograms per injection, 2 to 3 times daily, morning, post-workout, before sleep. Cycle length: 8 to 12 weeks typical, with breaks in between. Injection route: subcutaneous, abdomen, thigh, rotate sites. Timing strategies: morning fasted, increases fat burning. Pre-workout, enhances recovery signals. Before sleep, boosts natural nighttime GH release. Stacking with other compounds: CJC 1295 plus Ipamorelin. Classic combo, strong natural GH pulsation. Mimics the body's circadian rhythm. GH plus Ipamorelin. Ipamorelin stimulates natural GH, while exogenous GH raises baseline. Together, create both baseline and pulse peaks. IGF-1, either DES or LR3. Adds direct anabolic and fat loss synergy. MK677 or ibutamorin, oral GH secretagogue. Stacking with Ipamorelin is controversial, may oversaturate GH axis. Benefits of Ipamorelin: muscle preservation, keeps gains during cutting. Fat loss, mobilizes stubborn fat. Joint repair, supports tendons and cartilage. Bodybuilders often report fewer injuries. Sleep improvement, many users experience deeper, more restful sleep. Low side effect profile, minimal hunger, cortisol or prolactin spikes. Side effects and risks: mild or common. Headaches, flushing, dizziness, short-lived. Injection site redness or irritation. Slight water retention, rare. Serious or long-term risks: overstimulation, aka desensitization of GH axis if abused. IGF-1 elevation may raise cancer risk in predisposed individuals. Insulin resistance if combined with other GH secretagogues excessively. Harm reduction guidelines. Blood work monitoring. IGF-1, fasting glucose, liver, kidney markers. Pulse strategy. Avoid continuous high dosing. Use in pulses to mimic natural GH rhythm. Psychobreaks. Allow GH receptors to reset, 8 to 12 weeks on, then off. Healthy lifestyle. Sleep, stress management, and diet are as important as peptides. Data science versus hype. True, Ipamorelin is one of the safest GH secretagogues available. True, it boosts GH and IGF-1, supporting fat loss and recovery. Exaggerated. Claims of massive steroid-like muscle gains are unrealistic. Reality. Works best as part of a long-term peptide protocol, not as a quick fix. Conclusion. Ipamorelin has earned its place as one of the cleanest, safest peptides in bodybuilding. With its ability to increase growth hormone without raising cortisol or prolactin, it offers real benefits for fat loss, muscle preservation, and recovery. But like all peptides, it's not a magic bullet. Results depend on proper training, nutrition, and responsible cycling. Used smartly, Ipamorelin can be a valuable tool in a bodybuilder's arsenal.